Good morning. Thank you, everybody, for showing up this morning. We're going to be going through the Health Subcommittee recommendation to the Appropriations Committee. There are quite a few changes in here. Most of these we've been discussing as we've been going through, so we've got a lot to cover in a short period of time, so I'm going to go ahead and get started with this. You all have your tracking sheets there. On the first page, 17.1.4, this is where we've been able to recoup some unused funds on that Navigant report. 17.1.5, this is just language where we're instructing the department to go ahead and ask for a waiver so they could use the try to do the statewide CMO for the that we thought we were going to be able to do for the young folks. 17.2.2, this is restores $25,000 to the Burns Center in Augusta. 2.4, this is startup funds for for the Association for Primary Health Care for 2 federally qualified health centers that help treat the folks in our state who, regardless of their ability to pay. 17.5.1 and 17.5.2, there's language in there only. This is saying no to making that into a blended department there, and we'll talk about that in a minute when we get down here. Under ABD, 17.6.2, this is where is language that we were talking about transferring that into the other department. We said no with that. 6.4, this is something I think everybody will be interested in. This is a very important item. This restores the 0.74% proposed cut to all the providers across the state, and you'll see this in other areas as we deal with low-income peach care and all as we go through there. 6.5 basically was the change of the coding, and this restores 50% of the change in that code when they changed the code, or it would have been a big cut, but that restores 50% of that. 17.6.7, this allows the implementation of this new grouper payment methodology, but does it in a budget neutral manner. So there'd be no cuts there. 6.10 reflects savings through the patient outcome incentives, and we were able to recoup more savings there, and that number is larger. 6.14 is the increased funds for growth in Medicaid. The 6.15 is a truing up of the hospital cost settlements. 6.16, this is recouping the language that we had on the single-dose vial reimbursement that was not implemented. 6.17 allows for an increase of 28 slots in the ICWP program. The 6.18, this reinstitutes this single-dose vial administration where the doctors do this in their office rather than having to go to the hospital, and that's in there. I think it'll end up being a savings overall, though. 6.19, this brings all the FQHCs and the rural health centers up to the same base in their reimbursement level. 6.20 is just some language. We're saying yes there to that. 6.21 is this item creates a quality incentive program for the SOURCE program, and it rewards higher achievers in that program. 6.22, this gets back to where I mentioned that we weren't going to try to blend all that into one program. In the past, they've had a 2% variance. This will give them 10% and give more flexibility to the department. So we think that'll be a positive thing for help the department manage their program as they move forward. Under low income, 7.2. There again, that's the transfer, and we're saying no to that. 7.4. This reflects the savings from the electives of the prior to the 39th week. 7.6, there again, this is the reduction in that 0.74. It restores that for the provider rate that we talked about. 8.11, it reconciles the payment to the actual claims. 17.8.12, this brings there again to that same rate. That's a repeat from earlier. 17.9.2, this reflects the full health insurance earnings in QBE that goes to the state health benefit so that it'll be easier for the school systems to manage their budget. 17.11.1, this reflects the residency program that they're just talking about. This is going over to the Regents. This was taken care of Gwinnett Medical Center in Southwest Georgia Consortium, and that'll be under the Regents program. And 11.2, we're saying no to that. This restores that 3% cut to the graduate medical education. 11.3 funds the second year for the new DO residency program at Houston Medical Center for a total of 15. 11.7, this is an add there to help look at starting 2 new residency programs at Wellstar and East Georgia Medical. 17.12.1, this restores a 3% cut to Mercer. 17.13.1, that's going to be a little bit different on your sheet, I think, but basically what we have done is they're going to be happy with that. This restores a 3% cut to Morehouse, and then and we transferred some money in 13.2 so that they can use that for their matching money, which will help them leverage get the maximization out of that money by leveraging it. Under public health, 37.1.2, this transfers the Georgia Core to the Department of Public Health. Now that was over in the Department of Economic Development. The 37.1.5, this is the funding for the regional cancer coalitions around the state. 37.2.1, this is where the federally qualified centers and rural health centers are going to be taking on the folks that were in that hypertension program around the state. They'll be phasing that into them, and they should get really a better care out of that. 37.5.1 is a small reduction in the additional TB funding. 5.2, this is for the Poison Prevention Center. It adds a little more money to them. They're 24/7, located here in Atlanta, but they serve the entire state. The 37.7.3, this recognizes, it restores $50,000 to the hemophilia contracts because the feds have stopped accepting patients on that precept that we've been able to do before, so that's helping them out with that a little. 37.9.1, this is increases funding for the infectious disease controlled. The public health had been able to use some funds from CDC to help with that, but that's no longer going to be available, so we're going to put some state funds in there to help with that. 37.11.2, this is something we've all been working on. This is year 3 of the 7-year phase-in for the grant and aid formula to hold the counties harmless across the state. And 37.14.2 is a reduction in the money for the Trauma Network Commission. And that completes our report there. It's the pleasure of the committee. Have a motion in several seconds that we do pass. Any discussion? All those in favor say aye. Those opposed? Thank you.